So hello, everyone. I hope everyone can see me and hear me. Welcome to How to Improve Employee Healthcare and Reduce Costs with Direct Primary Care. So we're going to go through the presentation and we'll leave some time at the end for questions. So if you have any questions, please go ahead and put it in the QA section and then we can take the questions at the end. So I'm Dr. Chinelo Okoye. I'm a board-certified internal medicine physician, and I am the practice owner of Katy Premier Primary Care, which is a direct primary care practice in Katy, Texas. Katy is in the suburbs west of Houston. I have been in practice for about 18 years. The last 15 I have been in Texas. And yeah, so that's me. That's who I am. So Nir, let me let you go on and introduce yourself to everyone.
Absolutely. Thanks so much, Dr. Okoye. So I'm Nir Patel. I am co-founder of Virtuous Benefits. We are a healthcare insurance agency that helps employers learn how to create health insurance plans that are affordable and that revolve around the direct primary care model. I'm also Chief Operations Officer at DirectMed DPC in Austin, Texas, which is a DPC practice that my wife owns.
Okay, perfect. All right. So, oh, it looks like we have some, can you mute everyone, please? Chuck? We have some echo.
Yeah.
All right, thank you. Okay. So let's go ahead and move to the problem. So this is what we're here to talk about today. So the problem, as we all know, is that employer-sponsored health insurance premiums and worker contributions continue to rise annually, right? This is a problem. These graphs you can see are from the Kaiser Family Foundation. They do a good job of keeping track of these things. The graph on the left is basically the trend of health insurance premiums for families between 1999 and 2023. Okay, and as you can see, it's been a steady rise, and it doesn't appear to be slowing down. Similarly, the graph on the left shows what the family contributions are. So what the workers' own contributions to the health insurance premiums are between 1999 and 2023. Again, a steady rise. So this is a problem that is really not going anywhere. It's a problem that really needs a solution. So what do you want as the employer? As the employer, you want a solution to this problem that permanently lowers your health insurance premiums, right? Because you don't want to have to deal with this every year, year in and year out. You want to solve this problem permanently. You want to maintain quality of care for your employees, right? Because you don't want to feel that you're, somehow taking away, care for your employees. You want to still provide your employees with high quality healthcare. You want to meet all legal requirements. This goes without saying. Whatever you do has to meet legal requirements. And lastly, you want to permanently lower employee costs and out-of-pocket costs, out-of-pocket expenses. Now, this last point is very important. It's extremely important, actually, because even if you as an employer can somehow afford the rising health insurance premiums and you're able to get through, this year after year, your workers cannot afford this. Your employees cannot afford this. And, if they have to keep dealing with rising employee contributions and expenses, they're going to leave, right? They'll end up wanting to leave you to go to a job that can offer them better benefits. So this is a problem that you want to tackle as an employer if you're going to have your business continue to thrive. All right, so what's the solution to this problem? The only solution to this problem that is available as of now is the combination of direct primary care with different options that meet the legal requirements, okay? You can combine direct primary care with a high deductible traditional insurance plan. You can combine direct primary care with a self or level funded insurance plan. You can combine it with a health share. You can combine it with an indemnity plan, a health reimbursement arrangement. These are all options. And we will talk a little bit more in detail about some of these options. But this is the solution. And the key point that I want to make is that direct primary care is the foundation of all of these solutions. And we'll explain why in the next couple of slides. So let's get right to it. What is direct primary care? Direct primary care is a model of care where patients have a direct relationship with a direct primary care practice in exchange for a low monthly membership fee. When they pay that fee, the members of the practice are able to receive easy, timely, convenient, and unlimited access to primary care with many services included in the membership. Direct primary care practices do not bill insurance for the services they provide. All these services are either included in the membership or available for a small extra cost. So when you think about it, this model of care is really how things used to be before we had a lot of third-party involvement in healthcare. It's not new. This is how it used to be. Patients or their families would have a family doc that they have a direct relationship with. They'll go there and get care, and that we didn't have a lot of third-party involvement. So this is pretty much going back to that. And I should mention this model of care is inherently very cost-effective, right? Because you pay that monthly membership fee, and let me go back. So you pay the monthly membership fee, and your employees receive unlimited access to care with several things included. It's already very, very cost-effective. And so this fee can be paid for by the employer, or it can be split between the employer and the employees. So it just depends on how the employer wants to set it up. It is estimated that a direct primary care practice can handle over 90% of all primary care needs. That's a lot. Most primary care practices in the traditional setting don't handle that much because they're not designed to handle that much. And we'll talk about that more. But direct primary care practices are able to handle over 90% of all primary care needs. So, I just want to take some time to share a little bit about my own personal experience with this model, to just add a little bit of perspective to our conversation. Like I mentioned before, I'm an internist. I've been practicing for about 18 years, last 15 in Texas. And I've practiced in so many different types of models. I've worked in, private practice. I've worked in hospitals, government work, so many places. And one thing that I found, or that I saw as a recurring theme in all these places where I worked, was that the care was missing in primary care. The care was missing. Isn't that sad when you think of it? And it's because of the model of care. The traditional model of care is designed to focus more on quantity rather than quality, right? You only have 15 minutes to see a patient, and you have to somehow provide what they need in the 15 minutes. It didn't work. It just didn't work. So a lot of patients were dissatisfied, and it didn't matter how good of a doctor I tried to be. It just didn't matter because the system just wasn't designed to work. So when I eventually learned about this model, it was like a no-brainer to me, because it reminded me of how I envisioned that I would practice when I was in medical school. I always envisioned that I would be able to really take care of patients and get to know them. And so this model was just a no-brainer to me. It's fantastic. I transitioned over to this model about 3 years ago, and I absolutely love it. My patients absolutely love it. That's the key thing to point out. The patients absolutely love this model of care because it's very personalized. It's like, you get to know them, their families. Yeah, it's really a great model. And I have done a lot of talking, so let me let Nir share some of his own personal perspective on with direct primary care. Go ahead, Nir.
Yeah, thanks so much, Dr. Okoye. My wife has a similar story. My wife, Dr. Katrina Iqbal, has a similar story to yours, where she worked after medical school and residency. She worked in urgent care facilities around Austin, Texas, and just very quickly realized that she's not providing genuine care. And
Right,
that's
right,
really what direct primary care is. It's exactly what you said. It's taking medicine back to its roots,
right.
of how physicians used to practice 50 plus years ago, where they had a very meaningful relationship with their patients. They know their patients as individuals rather than, kind of a
Exactly.
volume-based situation that it is now. And so, um, so that's why she decided to go into direct primary care 9 years ago.
Right.
So yeah.
Yeah, and how has your experience been? How do the patients respond to the care that your wife is providing?
So our patients also absolutely love it. We take care of many retail patients and also many employer group patients. They all
Mm-hmm.
absolutely love it. Um, I encourage everybody on this call to look at reviews of direct primary care practices in your areas.
Yep.
I will bet they're probably all as close to 5-star as they can be. Um, and
Right.
and all of those reviews that people write, those are actual patients that are describing the type of care that they get from their doctors in DPC. And it's very clear when you read those reviews how much they love this model.
Yeah. Yeah. Thank you for that. That's absolutely true. Okay. So you might wonder, we've talked about direct primary care now, right? So now you might wonder, you might have this question. How does direct primary care help solve the problem of rising health insurance premiums and rising employee out-of-pocket expenses? So we do this because we're able to provide our patients and your employees with easy, timely, convenient access to care and taking care of over 90% of primary care needs in a very cost-effective way, right? Easy, timely, and convenient access. Most direct primary care practices have, easy ability for the patients to contact us by texting, by video visits and things like that. And so a lot of primary care needs are taken care of in a very cost-effective way because everything is pretty much included in the membership fee, with the exception of very few things. And so what this ends up doing is that it leads to a big reduction in the unnecessary ER and urgent care visits and specialist referrals. Those really expensive places where people would tend to go to in the traditional system because they don't have good primary care. We know that when you have a lot of expensive care and expensive health insurance claims, that's what leads to the premiums to go up. That's what leads to your health insurance premiums going up. So that's how this works. By providing your employees with this easy, timely, convenient access to care and handling everything in a cost-effective way, we reduce these expensive claims, we lower your employee out-of-pocket expenses, and also because direct primary care practices have more time to actually spend with patients, because we're not incentivized to, see a lot of patients and bill insurance. Because we have that time, we're able to focus more on prevention. And when you have more time to focus on prevention, you're able to prevent all those illnesses that get diagnosed when patients don't have good access to primary care. Think about the hospital bill from having a stroke or heart attack or uncontrolled diabetes hospitalization. All those big bills can be prevented by having good access to primary care that is inherent in this model. So that's how it works. So now what about insurance, right? Because by law, if you're a company that has 50 or more employees, you are required to provide insurance to your employees. And we know that direct primary care is not insurance, right? So then what? How do you as a company, how do you meet the legal requirements? You meet the legal requirements by combining direct primary care with all the options that I described. Things like a high deductible traditional insurance plan, and we'll talk more about this, but the high deductible traditional insurance plan, self or level funded insurance, these two meet the legal requirements. They are ACA compliant and they also meet that health insurance requirements. A health reimbursement arrangement can meet the requirements depending on how it's set up. But so yeah, these are the options. These options are absolutely compliance, they meet the requirements. Health shares and indemnity plans do not meet that health insurance requirement because they're not health insurance. But they are certainly an option for employers that have less than 50 employees and are not required by law to provide health insurance. The key points, again, is that direct primary care is the foundation for all of these solutions. All right, so I'm going to pass it on to Nir to share a little bit more with us about, some of these solutions, the high deductible traditional insurance plan, self or level funded insurance. He's going to talk about that next. Okay, go ahead, Nir.
Sure. Yeah. So there's a few different structures of health insurance. The most common is called fully funded or fully insured. That's the traditional model that's used by most employers around the country. And in that model, essentially, there's the premiums are not rated logically because whatever brokerage or agency that you're using, they basically just provide a spreadsheet of demographics of the employees to the insurance company. And it really just gets plugged into an algorithm that spits out a number in 30 seconds. So if you don't know if somebody's 40 years old and healthy or 40 years old and chronically ill, if the insurance company doesn't know that, they're going to overcharge you because they're never going to lose money. So
Right.
Premiums are rated illogically on the fully insured plans. And then when you do get a number, it's usually very high, but there's no transparency behind that number. They don't break down that number in any way. They don't tell you, if it's let's say it's $600 per employee per month. They don't tell you anything about how much of that 600 is their profit, how much of that 600 are they reserving to pay for claims, etc.
Right.
So
they can pretty much charge whatever they want, right?
Right, and you're in the dark as an employer, having no idea what's happening to the money that you're paying to help take care of your employees. And then in addition to that, when every time that your employees use their health insurance card through these networks, Blue Cross's network, United Healthcare's network, Aetna's network, et cetera, when you use those insurance cards, that is the real place that the insurance companies make their money. It's not off of the. And what I mean by that is when you start using your health insurance, there is an actual cost for a healthcare service. And then there is administration costs that Blue Cross and Aetna and United put on top of that service or visit for auditing the bill, verifying billing codes, passing it between 5 different people to handle it, to cut a check. And then Blue Cross also has to make their money, so they put another admin fee on it. So, a traditional specialist visit that costs $300 might turn into $1,200 when you use your insurance card. Same thing with advanced imaging, right? If you need an MRI, they're going to bill usually somewhere between $2,000 to $3,000 for that MRI when the actual cost of it is $500. Right. So we're exorbitantly overpaying for everything that we use in healthcare, and the money is going to the carriers through administration. And so that's another problem. And then the last problem with the fully insured health plans is every year when your broker or agent comes back to deliver your renewal of what your rates are going to be the next plan year, it's always bad news. 100% of the time it's bad news.
Yep.
Meaning going up, and it typically goes up somewhere between 10 to 30% every single year. So that means in 5 years, your insurance went up 50% at a minimum. Our wages aren't going up that much. Our revenues are not going up that much. So it becomes a real problem for employers when the insurance is rising at those unsustainable levels. They really have to start creating new business extensions to pay for it, or getting rid of certain parts of their business to get rid of those employees that would be needing insurance. And the other problem with that is the broker compensation. So the way that your agency or your broker is paid is something that you need to understand, right? Because the carriers, Blue Cross, United, Cigna, and Humana, they tie broker agent commissions to the employer's premiums. It's a percentage of the premiums. So every year when your broker is delivering this bad news that we're getting another 15% increase this year, they're getting a raise at the exact same time that they're delivering bad news to you. So you really want to make sure that you're working with an advisor that is incentivized to be aligned with your company's objectives, not the insurance carrier's objectives. Um,
And that absolutely right. Yeah. Yeah. Okay.
and And then we have level funded and self-funded plans, which I believe are, the solution. And that's what the majority of our agency does. So self-funded health plans, they basically address and correct all of those problems that I kind of went through on the fully insured side. So, and I also want to clarify, self-funding, it sounds scary. It sounds like I'm telling employers, forget about insurance, just fund all your own claims yourself. That is not what it means. We have an insurance built in the background in self-funded plans that's called stop loss insurance, and that's a very critical component of the plan. That is basically the real insurance within our self-funded insurance plans that picks up the hospitalizations, the cancers, the major surgeries, all the catastrophic things that we're worried about. Stop loss insurance picks up all those claims with no limit at all. So
Right.
I want to be clear about that. But what it does is, number one, the premiums get rated logically. We're either getting having the employees do a quick basic health questionnaire, or we're using claims experience if the company's large enough from their previous 2 years of claims to get quotes. And so when we're rating the premiums on the health of the employees, now we're able to create a logical number on what makes sense based on the actual health of people. And if your employees are able to show up to work every day, they're generally healthy.
Yeah.
Um, so, so we're usually able to get an immediate reduction there. And then the direct primary care is also the most critical component within these health plans, because when we rate the premiums logically in these plans, we're able to give the employer complete transparency on the number. So we're able to tell you exactly what's happening to every single cent that's getting paid into the health insurance plan. And that's powerful when you combine it with direct primary care, because the direct primary care doctors like Dr. Okoye are taking amazing care of their patients, handling about 90% of everything that they need for their health in a very high quality way, giving them their cell phone number, giving them their email address, spending an hour at every visit. And what that's doing, in addition to physically making your employees healthier, is it is steering all these unnecessary claims away from the health insurance plan.
Right.
Uh, and
Right.
when we give transparency around the money, we're actually able to refund any of that unused money back to the employer. And pretty much every client that we have around the country gets a refund every year, because all of their employees are using direct primary care and getting such good access and high quality care.
Yeah. Yeah. That's absolutely interesting. And I remember the first time when I learned about self-funded insurance. I thought it was scary too, right? Because I didn't really understand it. And then as I learned more, it made a lot of sense. It is really not scary. It's not. And I just want to reemphasize what Neer said about stop loss insurance. So this insurance is kind of part, you get that with the self-funded plan, and that covers you in case of any big expense that exceeds your budget. So if you're self-funding a plan and you've set a budget, and somehow there's someone gets diagnosed with something that requires a lot more than what your budget set, the stop loss insurance pays for that. So I think that the more employers know about self-funding, the more they'll get comfortable with this whole thing, because it's really a part of this solution. It's a big part of the solution. Yeah.
There's one more point I want to add to
Hmm.
the self-funded insurance structure. So you can self-fund with a network. So you can use Aetna's network, Blue Cross's network, Cigna's network, right? You can use networks,
Hmm.
but as we mentioned, the networks are where the insurance companies are making the bulk of their revenue, and it's the place that is making the cost for employees so high. And
Right.
so those networks are unnecessary. And when you're using those networks, when you agree to use a health insurance plan that's tied to a network, you're essentially agreeing to predetermined contracts between the insurance company and the providers and facilities without seeing what those contracts say. You're agreeing to those contracts. So you lose all your negotiating power when you
Right.
use a network. So what we do with our clients is we remove the network. We help them remove the network. So we can self-fund a health insurance plan or level fund a health insurance plan with no network. And
Yes, yes.
I would agree that that's a better solution, because people think, well, I have so many options with a network. With no network, you have even more options, right? You can literally
Hmm.
go anywhere you want for care,
Right.
and we are able to negotiate, and all that negotiating happens in the background. The employee never deals with it, the employer never deals with it. We have vendors in place that are built into the insurance that do the negotiating. And
Right.
it's all based on Medicare, because Medicare are the rates that we actually know. Nobody has a price anywhere for healthcare. So we know what Medicare pays for things, and we pay a very fair multiple of Medicare, and we pay very quickly. And so all providers and facilities around the country love our health plans because they get paid very fairly and very quickly.
Absolutely. And yeah, I think more people need to know about, these the networks and the charges that come with being part of a network. We we really don't need them. Um, yeah, yeah. Thank you for that information. Okay. All right. I think you already covered level funded insurance, I believe.
Yeah, so
Yeah.
level funding is pretty much the same as self-funding, except it's
Hmm.
just for smaller companies.
Right.
So we have many clients that have 2 people, 3 people, 5 people, right? You can self-fund with a small company like that, and
Hmm.
it would be under a level funded structure where you know exactly what your premium is every month. And it still has all the same features of stop loss and transparency, and it couples really
Right.
with direct primary care.
Okay. All right. So how does self-funded or level funded insurance save money for the employer? Right? So Nia already covered this. He already covered this. It is because traditional health insurance premiums are inflated because of no underwriting. They're basically designed to generate a lot of money in premiums and pay out as little as they can in claims. We all know this. We know how it is in the real world, where you think you have insurance, quote unquote insurance, and you go and see a physician, and then they end up denying your claim and stuff. So they're designed to make profits. On the other hand, when you self-fund your health insurance plan for your employees, you as the employer will have total control. You have total control, you know where the money is going, and any money that is not spent in claims, like Nia said, can be saved for future payments of claims. You get a refund even on monies. So that's the difference. All right, so now you might ask, if I am providing self-funded or level-funded insurance to my employees, why do I need direct primary care? And the reason is because this solution we described will not work to lower your premiums and lower your employee out-of-pocket costs without direct primary care. It just won't work. And the reason is because if your employees continue to seek care in the traditional primary care system, instead of seeking care in a direct primary care system, you can easily exceed your budget, the budget that you set for, your self-funded or level-funded insurance. You can easily exceed that budget, and that's going to cause problems, right? So the main reason why the solution works is because the direct primary care part of it helps to keep costs at bay. It helps to keep your employees healthy. It provides cost-effective care and prevents that overutilization of care that we see in the traditional system. The system, the way it's incentivized to bill on as many patients as possible while doing the bare minimum for the patient. That's how it is in the traditional system. We all know that. They keep the schedules full and refer patients out for things that could easily be handled by a direct primary care physician who has the training and the time to handle it. So that's how this works. You definitely need direct primary care as part of the solution if you're going to really take advantage of this solution. And again, I cannot stress enough the importance of keeping your employees' expenses down if you're trying to solve this problem.
And just to add to that,
Mm-hmm.
what we're doing in this strategy is we're reducing cost, absolutely, but we are not reducing cost at the expense of quality.
Oh,
That's one of
yes,
that's one
yes.
of the most important takeaways is we're actually increasing the quality of everybody's care by incorporating direct primary care. Um, and so that's, that's the main point I want to get across, in this section is most companies every year they do what's called a healthcare dance, right? They get a renewal, maybe it's 18%, maybe it's 25%, and then everybody starts to panic, right? This is an unsustainable increase. What do we do? How do we get this lower? And all they can do is, well, let's move from a PPO to an HMO. Let's narrow the network. Let's give less access
Right.
to high quality care, right? That's what traditional agencies do to lower cost. And in our model, we're able to lower costs through all these different mechanisms we've been talking about, but not at
Mhm.
the expense of quality. We're increasing the quality of care.
Absolutely, absolutely. And thank you for saying that. That's definitely a very important point. Direct primary care is a fantastic model. And like Neers mentioned earlier in the talk, look at some Google reviews of direct primary care practices. It's pretty much a concierge model, really, when you think about it. That's how patients feel about it, because the doctors actually have time for them. We're not spending only 15 minutes on the patients, and it really is a higher quality primary care than the traditional system where you only have 15 minutes and you get to refer everything out. So yeah, thank you for that. Okay, so what if you have less than 50 employees, right? So if you have less than 50 employees, you're not required by law to provide health insurance. But every business owner still cares about their employees, right? You definitely want to keep your employees healthy. You want to reduce employee absenteeism because all of these things affect your bottom line, right? If your employees are having to seek care in the traditional model, it affects their focus on the job. Imagine, in the traditional system where you may have to take an entire day off just to go get a cough treated, for instance. And in a direct primary care model, they can text the doctor or have a quick video visit and not have to take the whole day off work. So this model will help reduce that employee absenteeism. And then very importantly is the out-of-pocket expenses for your employees. The out-of-pocket expenses. If your employees don't have any access to healthcare at all because you're not able to provide insurance, and you're not providing anything, and they have to go to urgent cares and ERs because they have a minor, infection and end up with big bills, they're not going to be happy. They're going to leave eventually. They're going to want a different job where they feel that they can get better benefits. So providing direct primary care as a benefit to your employees is going to help you keep your good employees. It's going to help you hire and retain employees because you provide access to care in a very cost-effective way. So it's definitely still a big benefit for employers who have less than 50 employees. And then go ahead, Neer.
Yeah, I was just going to add to that so of course companies under 50 are not required by law to provide health insurance. A lot of them still want to provide it, but
Right.
they get scared when they go through the process of looking at quotes, right? They get not
Mhm.
scared, scarred when they go through the process of getting quotes because the numbers are just astronomical. I mean,
Mhm.
small businesses can't pay $600-700 a month for per employee for health insurance, and
Right.
health insurance that is then going to cost even more when you use it, like we talked about when people are using their networks, right? So
Right.
I encourage employers that are under 50 to look at it with an agency that actually understands how to do this model. We have many clients all over the country that have less than 50 employees that are using our level and self-funded health plans with direct primary
Right.
care, and it's very affordable. So I want to stress that our health plans are extremely affordable when you compare them to what the traditional brokers and agents are offering around the country.
Right. Yes. Thank you for that. Thank you for that. That's absolutely true. Because like you said, it's self-funded and you're removing the networks. So then it becomes affordable to employers that have less than 50 employees. So that's fantastic. Yeah. Okay, so now I'm going to pass this on to Anir to walk us through an actual case of a company to show you how they were able to save money and how they saved by switching to direct primary care and a plan with their company. Go ahead, Nir.
Sure, yeah. So this is a case study that that we put together with a roofing company that we work with in the southeast part of the United States. They are a larger company. They have about 200 employees, 15 offices spread across 4 states in the southeast. And really, they engaged us when their Blue Cross bill or renewal came in at 18%. 18% of an already very high amount, $800,000+ in an annual on an annual basis. So when you get 18% on that, it gets pretty expensive pretty fast. And so we were engaged by them to, basically look at their health plan and their employees and see what can we do to increase the quality and reduce the cost. So, I'll just kind of walk you through. They were using Blue Cross Blue Shield the previous year before engaging us. So of course it's a traditional fully insured plan that I explained before. So there is no claims fund. There's no money that's there's no transparency. Any money that's left over, Blue Cross keeps it. So there's no claims fund. They were not offering direct primary care. There were no expected claims, no actual claims. They don't provide any claims data to show you what's happening with the money. It's basically just here's your bill, pay it, and everybody has an insurance card. And so their actual spend was $885,000 before they engaged us. They got an 18% increase, which is $160,000 on top of that. So now they're at just over $1 million that goes to Blue Cross's pocket. So the next year with us, when we put our plan together, we removed the Blue Cross network and we put them on a self-funded plan. So now we have mounds of transparency behind that, right? So we've got a claims fund of $530,000. We've got DPC investment of $110,000. So the company decided to invest in direct primary care for their staff for all the reasons we talked about during this webinar. And so they understand that that's a cost in the grand scheme of things that is pretty affordable when you look at the kind of the total picture of what they're spending.
Right.
And then we've got actual claims data that we're able to provide to them and show them exactly what's happening with their employees. It's all anonymized, of course, but it's showing how many office visits, how many specialist visits, medications, hospitalizations, ER visits, and all those other things. And when we go through this process with our insurance carriers, we're using the health of the employees to determine what the rates are. So we kind of come up with a number of what we think is going to be expected. How much do we think that this group of 200 people are going to file in claims in 1 year? So the insurance company expected them to file about $210,000 in claims. Their actual claims ended up being closer to $163,000. Again, we're paying less for the same care that everybody's getting. So any specialty care, any medications, even if somebody ends up in the hospital, we're paying less for all of those things because we are able to negotiate, because we're not bound to these pre-negotiated contracts that we have no visibility to. Right. So the actual billed amount for those claims was probably closer to $1 million, but we ended up negotiating and paying $162,000 for those claims.
Wow.
So what that means then is there was a surplus from the $530,000 that we started with of about $260,000. And so the actual spend then became $560,000 rather than the $885,000 or close to $1 million that it ended up being after the renewal. So we ended up getting them a 22% reduction in cost. All the employees are ecstatic because they all have a direct primary care doctor that's taking really good care of them. And the company is thrilled because they can show their board that we now have a health plan that works for us. It's designed by us and it works for us. Our employees are happy. It's affordable for everybody, for the employee and the company. Everyone's getting healthier, and our costs are actually going down.
Right. And let me ask you, do you think that the savings is expected to actually go up? Yeah, and the reason I ask is in my own practice, for instance, I work with some employers, and I know there's a learning curve with using direct primary care. I had to, actually train some of the employees to call me or contact me, and they, instead of going to urgent care for certain things, things that I could easily handle. So you can, as I'm just thinking, this was the first year. Now imagine when all the employees actually learn how to use the direct primary care, what kind of savings we would be seeing.
Absolutely. Yeah, I agree with you. So when we do this through businesses, we always offer a DPC centered insurance plan, and then we offer a non-DPC insurance plan because we don't want the employees to feel forced to do something.
Right.
We want to make sure that they have options. We heavily educate them about why the direct primary care option is better, and we also make it look better financially. It costs less for them, and it also covers more things. We can include in this plan, for example, we include blood work. Any blood work that's ordered by the direct primary care physician is completely free to the patient. They have no deductible. Any x-rays and imaging that the direct primary care physician orders are completely included. So we help steer and incentivize the employees to pick the DPC plan because we know it's best for them.
Right.
But we're always going to have employees that don't choose that plan or that don't end up establishing care with their DPC or knowing how to use it, like Dr. Okoye was saying. So yes, throughout the years, as the employees that are using the direct primary care and are on that plan start kind of talking to their colleagues about how much they love it, we start to see migration of the rest of the staff moving over. And as the direct primary care doctors are training their patients on how DPC works and that, yeah, you can text me, you can call me, right? If something happens, I want to know because I want to help you with it. And I don't want to have to, and I don't want you to have to go to expensive specialty care and ER visits that are unnecessary and even medications sometimes that are unnecessary. So yeah, we definitely will see the savings continue to increase.
Right. This is fantastic. All right. So what's the alternative, right? You've heard all about this. We've, spent all this time talking about this solution. What's the alternative? You can decide to do nothing, right? But if you do nothing, it'll cost you. If you do nothing, your health insurance premiums will continue to rise to unsustainable levels. If you remember the two graphs that I shared at the beginning from the Kaiser Family Foundation, it's just been a steady increase since 1999. There does not appear to be any end in sight. So this problem is not going away. So if you do nothing, your health insurance premiums continue to rise. Your employee contributions and out-of-pocket expenses will also continue to rise. Again, this is important because even if you can somehow afford the care, if you as the employer can somehow afford the health insurance premiums, your employees cannot afford the rising contributions and the rising out-of-pocket expenses. So just because you can somehow come up with the money to pay next year and then keep paying, that does not mean that your employees are going to like that or going to be able to continue to afford this. So you have to think about how to solve this problem sooner rather than later. If you don't solve it, it leads to unhappy, unhealthy employees, and you can lose valuable workers and you can struggle to retain good workers because they'll leave. They'll leave and go somewhere else where they think they can get better benefits. And then your business ends up suffering in the end. So this is definitely a problem that you don't want to ignore. It's a problem that you want to solve sooner rather than later. All right, so you've heard all this and you want to access this solution. How can you get access to this solution? So like Nir mentioned, your traditional health insurance broker cannot help you with the solution. And the reason is because of how they're paid. They don't have the knowledge or financial incentive to offer you this solution. They are pretty much working for the insurance companies and they sell the insurance company products to you and they get paid based on commissions. So every time your health insurance premium goes up, they get a raise, right? So they don't have an incentive to show you how to lower your premiums and help you through this. So don't contact them. So there are only a few benefit advisors that work with direct primary care practices that can help you with this. People like Near and myself. We know how to do this, and we're not incentivized by any health insurance company because we're not paid by health insurance companies. So yeah, that's important to know. Contacting your broker will not get you to this solution.
Yeah, and I'll just help just understand, you know, kind of
Mhm.
how like our agency is paid. So we charge a flat monthly fee per employee for our services.
Right.
So we remove we ask every single insurance carrier to remove any commissions from the quotes that we get, and we charge the employer our fee directly. It's a flat fee, and so we're not incentivized to, you know, allow your premiums to continue to go up. And we also have mechanisms that we put in place to incentivize us to actually lower your premiums. So
Right.
we get paid when we lower your premiums. So that's
Did
really
you guys hear that? Nia, can
that's
you repeat that?
yeah, we
You
get
get
paid for your premiums. So
right.
that's the type of advisor that you want to be working with, is somebody who's aligned with your objectives, not the insurance company's objectives. And the other thing that's important to understand with agencies like ours is we are truly a full service agency. And what I mean by that is when there is no network in a health plan, things can get confusing, right? There's people that are trained at medical offices to look for Blue Cross and United and Cigna and Aetna on a card. And if they don't see that name, they're just trained to automatically tell you we don't take your insurance. But the truth is they're not that office's billing office, and the billing office is who takes money, and insurance companies pay every single provider and facility in this country money. And so that's all we're doing. We're exchanging money for healthcare services and we're negotiating. So our agency does all of that work. We are full service in that we will pre-set up visits for employees. So when they need to go outside the DPC office for something, we ask them to call us or text us or email us first, let us know where they want to go, or ask us to help them find somewhere to go. And we will pre-set up that visit for them so that when they show up for their appointment, nobody's telling them that they don't accept their insurance, and everything goes
Right.
very smoothly. And also within our insurance plans, people can pay cash if they want to get services, and then they can send us the itemized receipt, and we will file the claim for them, and the insurance will cut the employee a check directly. So it's very flexible, and we help them every step of the way.
That's amazing. That's even better than the traditional model because, as we all know, having a card doesn't mean anything, right? I've had patients who thought that they had insurance, quote unquote, and thought that certain specialists took their insurance, only to end up going there and finding out, nope, we don't accept it. So what you guys do to actually help walk the patients through the process is fantastic. Yeah. Okay. All right, so what next? You've heard our presentation and you would like to know more, go ahead and contact us. You can contact either myself or Near by shooting us an email, calling us, or just scanning the QR code that you can see on the screen right now. And we'll be more than happy to help you. And if we can't help you, we will point you in the right direction. Before we take questions, let me go to Near. Near, do you have any final thoughts? Anything?
I would just say that, you know, health care and health insurance is obviously a very important thing for employers to be able to provide that care and help to their employees and their families. And that directly translates to productivity in their business. These
Right.
costs, these costs are just continuing to rise unsustainably year after year after year. And you're going to get to a point where you're not going to be able to afford it anymore. And so you want to take control sooner than later. And when you're taking control of the costs, but you're also taking control of the care, right? Because your employees, your population of employees are basically a ticking time bomb, waiting for very significant health events to occur, right? That's going to happen to all of us. We're going to age over time. We're going to have chronic diseases that creep up on us over time. And it's really, really important to have good primary care, good continuity of care with the same physician that knows you really well, to be able to address these things at an early stage so that we can help keep people healthy for as long as we possibly can. And so taking control of your health plan is one of the main primary ways to do this. And working with advisors like us and putting together level and self-funded health plans that are combined with direct primary care is the solution and how to do it.
Absolutely. All right. So let's see if we have any questions to answer. Let's see. Okay. And it looks like we don't. So that's good. I guess we were able to answer all the questions through the presentation. So yeah, well, thank you, everyone. Thank you for your time. And please reach out to us if you want more information or want to know how we can help you.
Thanks so much, everybody.
All right. Bye.
Take care.